Are we, have we started?
Yes, it should be open. Oh, let me pause the recording.
Hi, everyone. My name is Jane Burke Miller, and I am a Senior Mental Health Training and Implementation Associate at the Center for Psychiatric Rehabilitation at Boston University, and the moderator for today's Making Sense of Employment Research webinar. The webinar is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. The webinar content does not represent the views or policies of the funding agency, and you should not assume endorsement by federal government. The territory on which Boston University stands is that of the Wampanoag and Massachusetts people, and we honor and respect the history and current efforts of Native Indigenous communities. This webinar is being recorded so that you can access it later. Also, closed captioning has been turned on, and you can access this by clicking the button at the bottom of your screen. In case this is your first webinar with us, I'm going to introduce our speaker. They will share their research with you, and then we'll have a question and answer session at the end. If you have a question during the presentation, please post your question in the Q&A box or in the chat, and I will pose them in order at the end of the presentation. If you have a technical question, please send a chat to me directly. Also, we would really appreciate your feedback about this webinar, so we'll be posting a survey of your opinions at the end of the session. Now I would like to welcome Dr. Anna Carolina Florence, who will be presenting her research paper, The Impact of the COVID-19 Pandemic on Individual Placement and Support Services for Young Adults. Individual Placement and Support, or IPS, is an evidence-based model designed to help individuals with mental health conditions to secure and maintain competitive employment. Young adults are a particularly vulnerable group in need of these services. The COVID-19 pandemic led many public institutions to curtail face-to-face contacts, which affected IPS delivery. This webinar describes a qualitative descriptive analysis of interviews with IPS team leaders across 5 states about their experiences with challenges and adaptations following the pandemic. Dr. Anna Carolina Florence is an assistant clinical professor of medical psychology in the Department of Psychiatry at Columbia University. Dr. Florence is a mental health services researcher specializing in implementing and evaluating the individual placement and support, or IPS model. Her work examines how evidence-based supported employment can improve competitive integrated work outcomes and overall well-being for diverse populations. Dr. Florence, welcome. We are excited to hear from you.
Thank you so much, Jane. It's good to be here. I want to start by thanking the Center for Psychiatric Rehabilitation and the BU group for this invitation. And I'm happy to talk about this paper that we recently published on how COVID and the pandemic impacted IPS services for young adults. So I'll go ahead and get started. I will share my screen and I will have you tell me whether you can see my slides.
Yep, we can see him.
Excellent. So thanks for that introduction. I want to start by saying that I have no conflicts of interest to disclose for this presentation. Jane, did a great introduction of my work. And so I've been focusing more recently on how employment can help people with serious mental illness and autism build meaningful lives that include work and community participation. So I have a number of projects and federally and state-funded IPS initiatives across the U.S. To implement, evaluate, and research individual placement and support. And I also have a portfolio of international work that I've been developing over the years. So today's talk will focus on this recent publication that came out in Psychiatric Rehabilitation Journal in 2025 called Impact of COVID-19 Pandemic on IPS Services for Young Adults. And I will definitely link the article for everyone who's interested in reading it through. I also want to acknowledge my co-authors on this paper, Manira, Jenny, Dan, and Gary, who were also authors on this research. So I'll start very briefly. I'm assuming that this audience will know what IPS is, and I bet there are multiple people here today who are IPS practitioners or researchers themselves. So I won't spend too much time talking about what IPS is, but for those who may not know, IPS is an evidence-based support employment model that has a very strong empirical support, and a lot of research has been done in this approach and has been implemented across all states in the US and several other countries, especially in the global north. Originally, IPS was developed for individuals, adults with serious mental illness. But over the years, it's been expanded to a number of other populations, including young adults, both with early psychosis and also with other mental health conditions. Um, and I'll tell you a little bit more about this research in the next couple of slides. But young adults are particularly vulnerable group. There are elevated rates of unemployment in the US, and also a number of serious mental health problems start at adolescence and young adulthood. And that's also developmental time when a lot is going on in people's lives, and a lot of disruption during that developmental period can cause serious problems in the future. So early intervention and working with young adults has been an area of intense research over the past few years, and has shown that early intervention is a very important aspect of mitigating some of these risks that emerge when people first start having mental health problems. Another thing that I want to mention that's going to be relevant for this presentation and this topic is that IPS, the model itself, relies very, very heavily on face-to-face engagement, both with clients and also work in the community with employers. And that's going to become relevant when we talk a little bit about the challenges that emerged in delivering this intervention when COVID-19 started and the stay-at-home orders came into effect in pretty much all states in the US. So just to talk a little bit more about the IPS research, when IPS emerged, it kind of came in as a new paradigm for mental health support. We know that most people with mental health challenges, there's extensive research in this area. Over 60% of people participate in research studies about whether people with mental health challenges want to work competitive or not. We've learned that they do want to work competitively. And that those results remain stable in multiple studies across the world. So we know that people do want to work. And we also see employment as both a civil and a human right. If people want to work, they should have the right to work. And they should get the supports that they need in order to fulfill this important area of life. Work, we know, is also a key part of recovery. It restores a sense of self, a sense of purpose in life, and it also mitigates a lot of more social problems like poverty and not having an income and being dependent on disability payments. So beyond the sort of restoration of the self and the help in recovering from a mental health challenge, it also serves a number of practical purposes in life that are very important. And being productive is a basic human need. It's a very important thing. So work is something that really everyone sort of should have the right to do. And in most societies, work defines the typical adult role, and that's relevant for young adults, especially because that's the moment when they're transitioning from a role of being more dependent on parents and on other supports to jumping into a more independent role, and work is a very important part of that process. And as I mentioned, employment can be a path out of poverty, which is extremely important, as we know that poverty and other social determinants of mental health are really very important for a number of negative outcomes. And also working may prevent an entry into the disability system, which can be very hard to escape. And I'm assuming a lot of you, or most of you, know the IPS principles, but one thing I want to highlight here is that IPS reverses the order of historically what we think that people need to first be stable, have all their treatment in place, not have active symptoms in order to then be ready to potentially get a job. But IPS really operates from a different perspective in that there's really zero exclusion in terms of who is eligible for services. The only criterion for a person to engage with IPS is to want to work. And then they get a number of supports from their IPS specialists, which includes everything that you're seeing here on the screen, including benefits counseling and other long-term supports for as long as the person feels that they need. And part of this intervention is also integrated with the treatment team, so it works well together with other mental health interventions and the mental health treatment team. And as I mentioned at the outset, there's a strong community component where IPS specialists are expected to be out in the community talking to employers and being out there with the person to help them get the job that they want. And I also want to briefly, I know I mentioned this is an evidence-based intervention, but I want to show you sort of just the scope of the research in this area. In this map, you can see where the studies have taken place, a number of randomized controlled trials showing the effectiveness of this intervention. Most of them, as you can see in the global north, are mostly concentrated in North America and Europe, but there are also studies elsewhere, and our team is also leading a number of international studies now starting in the global south. We have one pilot in Mexico and some work in Uganda that we're setting up right now. So we're starting to see also how this intervention may translate globally to low and middle income countries. And this summary might not be fully updated. I think maybe I worked on this a few months ago. I know there have been a couple of trials that came out since then, but you can see that we've had over 30 randomized controlled trials since the 90s. And I'm also on this slide, you can see here the differences in outcomes in those trials. We're on the left-hand side, the darker color is the percent employed in the IPS group in each of the randomized controlled trials, and the orange bar is the percent employed in the control groups. And you can see that in every single trial, IPS has much better outcomes than the control group. And the differences vary depending on the population. You can see that some of these results, the differences is smaller, and then in some, the difference is quite pronounced. And as I mentioned at the beginning, although this research and this intervention started for adults with mental health challenges, it has since extended to a number of new populations. And you can see here on the screen all the new populations that have had trials, including neurological disorders, obsessive compulsive disorder, post-traumatic stress disorder. And we're doing a study, a randomized controlled trial for adults with autism. And also within these new populations, you can see that young adults are a population for which there have been a few trials that have shown promise. So the evidence is emerging on that front, but it is promising. The few trials that exist have been synthesized into a systematic review that Gary and colleagues have done and has shown that IPS outperforms other support employment interventions, at least in the trials that we have seen so far. And this includes individuals with early psychosis for which there have been a few trials, but also young adults with any mental health condition. So I'll segue a little bit into the context for this study. I don't have to tell anyone that the pandemic caused widespread shutdowns of in-person and health and social services. It disrupted a lot of the services. Mental health systems had to very rapidly shift to telehealth and in providing remote services. And for IPS, there was a big concern at the outset around the ability to engage with participants, the ability to conduct job development, which is a central activity for IPS as an intervention, and also how that would impact the fidelity of the intervention. You know, how closely could it continue to be delivered in this new context? And it was also unclear whether this would have a particular impact on young adults who are already considered sort of at risk, and whether this impact could potentially be disproportionate for young adults. So that was an open question. And just to frame this study a little bit better, the study started in 2020, so and it went on until 2023. And as we go into the methods, you will see that the study that I'm presenting today is actually nested within a broader evaluation of IPS services. There was a qualitative and a quantitative component, and it was not originally written as an evaluation of the impact of COVID-19, but the first reports obviously started in 2020, and then this study was kind of underway at that time, and it had to sort of shift a little bit to also include the disruptions that happened because of COVID. So about 2 months into the broader study, this quantitative evaluation that Gary was leading, that's when the pandemic started, and then that opened the possibility to focus on these adaptations that were needed to accommodate for the changes that COVID created. So for this study specifically, this was the qualitative piece of the study, and then I can also provide the link to the broader quantitative study that explored IPS for young adults. Those findings were published in 2024, and we also had another study just with the broader qualitative work that didn't focus exactly on COVID-19, but just on the experience of providing IPS to young adults. And we published that in 2025, and I can also send you all the link to that other bigger study. But then because COVID happened, that was an opportunity to understand how IPS could potentially function on a more remote basis. So the goal here was to specifically focus on the challenges created by the pandemic, the adaptations that were made to continue service delivery during that period, and also to try to address this critical knowledge gap that we had in terms of whether IPS would be as effective virtually as it is in person, just using sort of COVID as this sort of unprecedented period, but also a natural experiment. So as I mentioned, this study in particular is a secondary qualitative analysis that's nested within a mixed methods evaluation of IPS for young adults. And the bigger qualitative study, as I said, is right here on your screen, was published in 2025 in Psychiatric Services. And then it just focuses on everything related to serving young adults using IPS, but not anything related to COVID, which is the focus of the study that I'm presenting today. And then just to let you know that the broader evaluation study, the quantitative part was an evaluation of employment and education outcomes over a 1-year follow-up period for 111 young adults, 16 to 24 years of age, in 9 IPS programs and in 5 states across the US. So that was the broader study in which this one is nested. For this study in particular, we had our sample included 29 interviews with 30 participants, and our participants were state and team IPS leaders. So folks working either as providers directly on the ground or as policymakers or administrators within IPS, within states. We also had 2 waves of interviews that were conducted. There was an early pandemic wave that we did in 2020 and 2021. And actually, I was not involved in the interviews. I only came into the study later for the data analysis piece. So that was Dr. Bond's group. And then there was a second wave of interviews with the same participants, and no one was lost to follow up then in 2023. So we have here a sample of conversations that we have when things were just starting to change because of the pandemic, and then we had a later follow-up where things were a bit more settled and people sort of got the hang of working remotely, and things looked a little different on wave 2. And as I mentioned, these interviews covered, serving young adults more broadly, which was published in the others paper. But our paper focuses only on the experiences related to COVID-19 directly. So we analyzed these data, and 2 major themes emerged or were identified. The first theme was just the challenges to service delivery that came up in serving people remotely or using telehealth. And then there was also a prominent theme around adaptations and innovations that sparked in the context of serving people remotely. And the themes were consistent across both interview waves. So we ended up just harmonizing, not really separating these 2 waves. But I will tell you a little bit more as we go through the results, where the early interviews really emphasized disruption and uncertainty, whereas the later interviews reflected more of a learning, stabilization, and reflection, since people had kind of figured out how to deliver services, and were really learning how to optimize services in this new context. So you won't really see when I present the results a separation between waves 1 and 2, but during the discussion, we kind of make that distinction. So starting with challenges, and this is already we're diving into the results of our analysis. In terms of the challenges, there was a prominent theme around engagement and referrals. So engagement very quickly became more difficult without in-person contact, and we heard that from a number of interviewees. And then building rapport and relationships over Zoom or phone was especially challenging for the people who interviewed for the study. Especially challenging for young adults. There was also an issue with referrals. They really declined very sharply. Mental health teams and VR agencies slowed or almost stopped referrals right after the pandemic. And there was also big hesitation on the part of families in terms of having their loved ones engage in IPS just because of the risk of infection and of getting COVID. So people were more hesitant in terms of, is this the right time to start getting a job given all the uncertainty? And then the initial enrollment period, which typically, before the pandemic was kind of quick, took much, much longer. So building this rapport and building the relationships, that kind of changed a little bit, and people felt like they had to work on that initial building of rapport more intensely. And here's a quote from one of the team leaders that were interviewed. This person says it did slow down the face-to-face aspect of COVID-19 when they were going out to do job development. Kind of almost made it a little bit non-existent during that time period because so many businesses had shut down and they went remote. So that, I guess, is a sort of very expected outcome, that it was just really hard to do job development in the community. And then also businesses shut down and a lot of other things went remote, not only mental health services. Another challenge that we heard a lot about was related to the actual jobs that are available and changes in the education. As you know, young adults often have a dual goal of obtaining employment, but also finishing their education. So employment specialists are often treading these two worlds and helping people find employment while also pursuing an education goal. So we heard that these entry-level jobs that have traditionally been held by young adults were either reduced or eliminated during that time. So those were not as available as they used to be. Also, there was increased competition from displaced older workers. And so just the landscape in general didn't look the same. And in a way that really impacted young adults' ability to find a job. Another thing that happened is that many employers closed completely and stopped hiring, or they moved to a fully remote schedule, which was not as common before the pandemic as it is today, and it was all very new when that started. Another issue or challenge that was brought up over and over again was that participation in education declined. And there was a question, I know that there's more research emerging now around, whether online learning, is as good as in-person learning. And I know that we're seeing that there are a lot of challenges in online learning. And this early on is something that, our interviewees noticed, that seemed to be a barrier, that online only learning was challenging for young adults. There was also, technology access issues. Some people, especially in rural areas, may not have access to the internet or don't have a device to, attend school activities. Um, and then in more rural areas or big urban centers, transportation remained an issue where it's just hard to either transport people because you can't put someone in your car with social distancing, but there are also challenges in actually coming to, going to the employer or going to an interview if transportation was not readily available. And the transportation challenge is something that we've heard in IPS research, and not just related to COVID, but it's a broader issue that comes up over and over again in a number of different contexts. And here we have a quote from a team leader saying that, and some jobs were shutting down and mom and pop places weren't hiring. Bigger companies were still hiring during COVID, but a lot of smaller type places weren't as open to meeting. It was more of the big corporations that were still hiring. And a lot of employment specialists just would rely on these mom and pop shops to place young adults. So that also changed, the availability of jobs in the community. And another quote here related to education, in terms of barriers to education, young adults are having problems with online learning during COVID. Young adults can usually focus better when learning in person, and many might not have the right technology. So that is a quote from a state leader bringing up this issue that we now know was very prominent, not just for young adults, but really across the board when things went fully online. And one quote about transportation is that transportation has been more of a barrier in being able to chase people in town and meet them out in the community and try to connect with them by driving them to work to get to meet has been harder. So this is just a lot of that work in the community that would happen. And that is part of the IPS employment specialists sort of bread and butter. That changed a lot, and transportation became a lot harder. So in terms of, and shifting a little bit from challenges to adaptations, I think the first thing we heard a lot about was this delivering services remotely. So IPS teams had to very quickly transition to telehealth and remote services, which was not their usual sort of way of operating in their services. So job development, instead of being out in the community, shifted to phone, email, some virtual meetings. So that looked very different. We also heard that a lot of programs experimented with a number of different things, including having virtual job fairs or working on digital applications, doing these enrollments of participants and clients remotely, which they otherwise would have done in person. And then one emerging need obviously was that just both staff and clients required additional technical support that was not, always available. So those were some of the sort of major adaptations related to just delivering services remotely, which was very different. And then the folks that we interviewed also brought up that there were adaptations that were seen as new opportunities. There was an expansion of remote and hybrid jobs, and that was seen by the folks that we interviewed as a positive shift overall. Some young adults, especially people with anxiety, really benefited from remote work. And also for people who have, other social difficulties. And virtual engagement actually increased the flexibility for clients and staff. If you don't have to come in, maybe it's actually easier to meet. You just pick up the phone, you do it from home. And some IPS specialists, in fact, reported that they preferred remote contact with employers than to meet them in person. And I should caveat this and say that I think the jury is still out on whether these remote activities are as effective as in-person activities. I don't think this issue is settled, but this is just the perception of the state and team leaders that we interviewed for this study in particular. So in terms of a discussion of what we learned from the interviews that we conducted. We know for certain that COVID just fundamentally disrupt some of the core components of IPS. As I mentioned, a lot of these activities just happen in the community, and the face-to-face component is so important. So we knew that this disruption was going to happen with this remote shift. One thing that was very, very prominent in our interviews is that the actual face-to-face relationship with participants really proved difficult to replace with virtual connections. And we explored this a little bit more on the other paper where we just covered sort of the broader differences of working with young adults. And we learned that the building of rapport and sort of the establishing the relationship with young adults is very different than with older adults. There is, this establishing a connection. That young adults often have different preferences for communication. They prefer text. They don't like phone calls. So there are just some differences that, employment specialists said you really have to adjust and be more flexible to meet those sort of different needs. And the other piece that also comes up in the other paper a lot more, we didn't focus on this as much on this paper, but that there is a difference in how young adults engage with jobs, where there is a little bit more job hopping. And that just may be sort of a developmental thing where people are trying things out, right? They're not really set on what they want to do. So this idea that you would just do a career profile and you would kind of figure out the person's interests doesn't fully align with that developmental period where people are still learning what kinds of things they like. And so that process can be a bit longer for young adults compared to older adults who may have either worked in the past or pretty much know what kinds of things they want, and are not trying things out all that much. And so this period of more trying things out and experimenting, that was difficult to do remotely. And a lot of employment specialists felt that sort of this building the relationship, and kind of determining people's interests and a lot of trying out new jobs and, job hopping a little bit, that would have been easier to do in person. So that was, one key impression that came out of these interviews. And despite all these challenges, and we all lived through this, and we know that it was very difficult and on so many levels. This is just, a narrow kind of focus on IPS, but life as a whole was very, very difficult for everyone. Um, Despite all these challenges, the programs really demonstrated a lot of resilience and creativity. And we're really able to pivot into something that worked in practice, despite all these challenges. And I think I don't want to put it as, frame it as a silver lining, but some of these adaptations, the people that we interviewed felt might have, lasting value. And that some of the changes that happened during this time may be sustainable and even desirable beyond the period of the pandemic. So those were kind of the key takeaways from the study. And it really also sets kind of the direction for the next steps for research in this area. Um, there's a lot of debate around, whether there might be some flexibility regarding fidelity, with the standards that of work in the community. I think that a lot of people still feel like the community services or core component are really important, that the face-to-face with employers cannot be replaced um, by remote. And at the same time, there were a few papers out there that showed that all of these changes to remote services didn't really impact fidelity all that much, or outcomes. And that a lot of folks thought that some of these hybrid opportunities might be helpful and not really impact um, outcomes negatively. So I will also say that I think the jury is still out on that one, and there needs to be more work developed in that area to understand what are the components of IPS that are really not replaceable by virtual options, and what are some of the things that could be, where there could be more flexibility. So that might be beneficial for programs, say in rural areas, or just where barriers to access exist otherwise. And there is a question, also an open question here, in terms of, technology may expand access, but it also raises equity concerns. And we know that, the access to technology is distributed unevenly. And if you rely on technology alone, you may create inequities that would need to be addressed or mitigated in other ways. I think the findings here support that we need to continue studying, flexible IPS delivery models. But we really need to understand better how they work, what components could be more flexible or hybrid. And so there is really a need for more work in this area so we can understand this issue better. And I also want to highlight that our study had several limitations. One key limitation here was that we didn't interview clients or families, which I think would be very, very important stakeholders. And I hope that other studies in the future look at the experiences of clients and families with this shift to remote services. I know there's been a lot of work in other evidence-based practices like coordinated specialty care that, and we published something on early psychosis programs going remote, and we interviewed clients and families for that. So I think this is an area where we would really need to bring in the perspectives of other stakeholders. Um, there also was, the experiences were really different across states, and COVID policies also varied across states. So, some states instituted stay-at-home orders pretty early on, and they were very stringent about it, and others were more lax, and we didn't take that into account in our analysis, but that would be an interesting thing to look at, all this variation and how that impacted programs in different ways. And also the interviews were short, and they were, even though we had 2 waves, it's just, a point in time where you're talking to people. And because we only looked at a time period of about 2.5 years, we may not really have captured the more longitudinal impacts of the pandemic with the way that the study was set up. So those are some of the key limitations that I would note when you interpret the results of our study. And to conclude, the pandemic posed major challenges to IPS for young adults, but it also, on the other hand, catalyzed innovation and adaptation. Um, and I think that the lessons that were learned in that period may strengthen future IPS delivery. And our findings in particular underscore the importance of flexibility, equity, and also the importance of centering the voices of the people who are on the ground and delivering the intervention in service design, and then in future adaptations or modifications that might happen to the intervention. So I hope that some of these lessons can inform future IPS service design for young adults, and that we can learn from that to move forward. So with that, I hand things over back to Jane, and thank you so much for the invitation. I'm happy to take any questions that may have come in.
Thank you, Anna. That's a really interesting presentation, and so, something I think we can all relate to, being recent history. Please go ahead and ask some questions, or put them in the chat, or put your hand up. Meanwhile, there were a couple things I thought of. One, your point about kind of job hopping and testing, that is really, it does make IPS for youth different from the original IPS. And, I don't know if your team leaders were any who were only on, it's pretty rare to have teams that are only working with youth. But I was thinking about that, and I think that just raises a lot of questions in general, but certainly during the pandemic, that ability to support people through different, so in the pandemic, there was that immediate, so many people lost their jobs, and then there was kind of slowly bringing back. It really changed the face of the workforce. It also made me think that for youth in general, the ones that were sort of like juniors, seniors around 2020, have just been reporting a lot of mental health concerns since then. A lot more anxiety, a lot more depression, difficulty functioning, difficulty working. And there's no reason to think that our population that's served by IPS teams didn't also have that. That was really kind of unique to the youth of that time, I think, because of their school. So there's sort of the question of, it's two things. It's like youth served by IPS need kind of a different focus anyway, and maybe youth who were on the edge of the pandemic at that time need a different focus too.
Yeah. No, I think those are really good points. And we got to develop those ideas a little bit more on the other paper that we published that was looking at these specificities of working with young adults. And really what we heard from employment specialists is that the expectations for that developmental period are a little different. There's also sort of an immediacy of things where, young people kind of want to see the results faster, so they're not willing to engage in like lengthy job search, and they kind of just want to get things over with. So the employment specialist said that it was a challenge for them who had been working historically with adults and had, a mixed caseload where they mostly saw older adults and they also had a caseload of younger adults. That for them, it was just really challenging to sort of understand this difference and how to engage with this population. But that once they got the hang of it, that they felt like, this is how it should be, right? Like things move at a faster pace. It's texting, it's a different way to communicate with youth. That employment specialist said, if you're willing to be flexible and sort of play to their strengths, it works really well. But if you just kind of trying to stick with a rigid sort of way to engage with these adults, that becomes very challenging. So that piece came up a lot in the interviews and the broader sense beyond the COVID related stuff. And this we need to understand a little bit better also, right? Like this is the impression of employment specialists working with young people. But we don't know like whether actually job hopping impacts, ultimate outcomes, or we're just not clear on this. And I think more longitudinal studies are needed. But you also bring up an important piece, which is, the pandemic kind of hit this group like in a totally different way, where, these are kind of moments in life, like a stage in life where it's really important to have your peers around, where social interaction is really a core, part of life, and the isolation that the pandemic, forced upon this group was really very detrimental to their mental health and sort of key milestones that they otherwise, would be meeting. So that's really hard to differentiate, right? What are the things that are, okay, this is an age where there's some vulnerability for mental health challenges versus what were some of the things that kind of were catalyzed by the pandemic because it kind of took away some of these very important pieces, especially on the social interaction that would otherwise be in place. I know there's some epidemiological studies that were done and that may kind of shed some light into the impacts, but I think it's looking pretty clear at this stage that there was a huge mental health impact, especially in younger people, um, just by virtue of staying home and not having those normal interactions. I guess we'll have to see how they catch up now that things are coming a little bit back to normal.
Mhm.
Uh, but I think you make very good and important points.
Yeah, thank you. I think we'll have you back to talk about the larger study.
Sure, yeah, I'd be happy to. And I'll also link the study so people can take a look at it. It was very interesting, to hear the perspectives and the differences in working with this population.
The youth. And finally, my last thought was just about, it was interesting talking about texting and meeting people where they are. I think, with increasing AI and virtual reality and so on, first it's going to change the workforce in the face of the workforce, and we're going to it's kind of like another disruption, like a pandemic, but, we all have to adjust to that. But I could also see developments of more like phone app, formats for communication. I think
Hmm.
young people might feel more comfortable with that because they're Instagramming all the time and so on.
Right.
But they really don't like to use phones, and they don't particularly like to Zoom. Well, this is just anecdotal. The young people I know. I think that there are some possibilities there. I know some researchers have been working with virtual reality job interview training. I think there's other opportunities like that, and hopefully that will be developed. So wonderful.
Yeah. I agree with you. I think you make excellent points there, and there will be disruptions to the, just the employment world based on these new emerging technologies that we will have to, just keep track of. But also, yeah, I think the ability of youth to navigate technology is something that could be leveraged. And I know our group is very interested in both these topics, how AI will impact, the workforce, but also create new opportunities. And we've been working in this area, and I hope that in a few years we'll have more to report on that front.
Excellent. Anybody else have any comments from their own experiences? We've only got a couple minutes left, but I think it all just, I think, what you found was very much what people experienced, but it's very helpful, I think, to think about the implications as we go forward. Okay. Well, we will look forward to having you again, and thank you so much for your time today. I have to do a little wrap up. So I think as we're coming to the end, I want to thank everyone for taking time out of their day to participate. I especially want to thank Dr. Florence for your work in presenting today. The video of this presentation will be posted online at the Center for Psychiatric Rehabilitation in case you'd like to access it later. In the meantime, when you exit the webinar, you'll see a brief survey. Please take just a moment to provide us with feedback before moving on with your day. Finally, we are in the process of scheduling other webinars in 2026, so pay attention to your email. And thank you all very much, and take care.